Help me understand, you touched on it a little bit, but help me understand the technology in terms of what we're measuring. So a lot of our audience members are familiar with ATP testers, which allow you to identify organic matter on surfaces, but you can't tell if it's alive or dead. What are we measuring specifically with the product as it is today? Is it organic matter? It's not specific pathogens? Is it the cleanliness? Can you be more specific?
Positive reinforcement. So given that there is that UV reflective dye in the alcohol-based hand rub, the training rub that we apply, we are able to see the intensity. So the intensity is in correlation with the amount of alcohol that was spread on that surface and the time it's spent on that surface. And the combination of two tells us from the efficacy tests that are compulsory on the laboratory condition for each and every product on the market, that within 20 or 30 seconds, the log5 reduction shall be achieved with those products. And this is our method provides a harmless positive reinforcement. And yes, that part of the skin received the required amount of the solution, the alcohol-based solution, and also the time exposure, so that we can be sure that that product was efficient. Therefore, all germs and bacteria, well, up to the extent of 99.999%, got extinct.
So just to clarify for our audience, are we able to measure the different variations in the disinfectants that are used on the hands, or are we really measuring the effectiveness of the hand washing process?
No, we are measuring the quality of the spread, so how well we're able to spread, and we have a baseline there. So we have qualified our system to be able to distinguish between a very light, I'm done, kind of I ran away with under 1 ml, you can do good hand hygiene, you need the proper amount, and this is really visible under the conditions of the semi-live scanner, because immediately you can show which is the area which got covered by the right amount of alcohol, and all of a sudden, it evaporates very quickly. So by the time you keep rubbing your hands for 30 seconds, but if there's no more solution in your hands, there's no more cleaning effect, actually.
Is the measurement specific to alcohol? In other words, can you use other disinfectants? There's a lot of hand hygiene disinfectants that aren't limited to alcohol. Alcohol, the most probably prevalent, but
and other weird stuff. So theoretically,
zirconium chloride, right?
Yeah, these dyes we could develop for other products. So far, we have been focusing on alcohol because that's the most commonly used. And again, it was hard enough for WHO and other CDC and other organizations to make people understand the importance of it. So let's not confuse them with talking about too many different kind of solutions, but those exist as well.
There's so much I want to talk about here, and you mentioned WHO, and we want to get to that. Do you endorse alcohol specifically, or is it chosen because it is the most prevalent? Because there have been some detractors to alcohol that over time it provides cracking to the hands, which can be a harbor for bacteria and viruses, and yet it is still the most common. It's a cost-effective solution, but do you endorse alcohol as the solution, or is your focus on alcohol because it is most prevalent?
I think it's the latter. So we have been focusing and looking into all technological solutions. So that includes other chemical solutions, disinfectant. But I have to say that after over a decade of daily using multiple solutions, and sometimes 100 times per day, depending if you're at the trade shows, so it's super important to demonstrate over and over again. And I have normal dry skin, and I use, especially in winter time, I have a lot of skin conditions. But the good quality alcohol-based products, they are fine. They are just fine. 15 years ago, that was not the case. The early products, they were very rough on the skin, so people did have a lot of problems. It still can happen. I think good institutions, what I've seen as a good practice, they offer alternatives. So then you can choose, and you can also have skincare products possibly adjacent to, so you're able to make sure that you're not only keeping your hands clean, but also healthy, because that's, as you just mentioned, that's very important.
I'm a big proponent of alcohol-based hand sanitizers. One of the big challenges that those of us in infection prevention know is the dwell time. So how does the HandInScan solution address dwell time? Can it tell the difference between an appropriate dwell time with an alcohol disinfectant versus, as you said, you rub it together and you're not getting the effectiveness? Is that measured?
So we are having right now ongoing research focusing on this, because so far evidence is quite complicated, so to say. So we all know that drying time is supposed to be like around 30 seconds, but it really depends on the hand size, on the really the temperature of the skin. It really depends on the concentration, because if it's it's 70% or 80%, it's going to be different than if you have a lower concentration. So all these things are just making very, very complicated and complex. But we do know that you have to wait at least 15 to 20 seconds, no matter how efficient by default your solution is. And on the top of that, we can definitely measure that. So we are working together with these smart dispensers, where who is receiving the dosage. Of course, so personalization is very important. We know exactly how much, the exact amount that got dispensed, because some people just say look, give me the lowest amount. And I have to tell you, some of the hospital procurement people and the finance people, they're happy because then you don't have to buy that.
The cost down, right?
But
keep the direct cost down, right? You spend less on the disinfectants, but what is the real cost, right?
Neither wasting the solution nor just using too little, because if that determines or sends you passive, you fail miserably spreading and cleaning your hands. What's the purpose? You really have to be able to get the right amount, and you have to get used to it. It's personal. There's a huge importance of personalized dosing, because I can do with 2.2 ml, I can do great hand hygiene. Some people, bigger hands, they need more. There can be some people who are able to rub in properly with 1.5 ml maybe. I've never seen a proper hand hygiene under 1 ml. And this is something that we can prove now, because this has been anecdotal, and people said no, my solution is better. No, prove it. Now
Right.
We have the right scientific evidence that we can create through the semi-wise system.
That's a great data point, and I want to get into the data. In my research prior to our interview here, I found it interesting that one of the other data points was the effect of jewelry, for example, rings, in the hand hygiene process. And talk a little bit about the data collected and the correlation with improving hand hygiene and patient safety, and how your product delivers the data and the cloud-based system that you utilize.
So just as you mentioned, technology can do a lot more for us than telling whether you missed something. Exactly, jewelry, you're wearing your wedding ring, and then people have been arguing for years that oh no, because it goes underneath and there can be no bacteria. But we have a study now. We have collected quite enough evidence that no, this is not good. I mean, bacteria can still thrive underneath those areas. And now our system is of those. It's again in the ages of artificial intelligence methods, it sounds easy, but it actually really depends on the quality of data. But we have now an artificial neural network working to identify rings, because then we can say okay, you are wearing a ring. Please make sure we are not going to be the one who judge you, but follow the guidelines. So if the hospital or your institution says you're not supposed to, please just put them down. We can record it, and the same goes for the data in general. So we don't want to be judgmental, and we don't want to penalize you. We want to generate that objective data, yes or no, correct or incorrect. And it's all goes down to statistics. Maybe it's okay if you miss your thumb every three time or every third time you come to the system. Maybe it's not. It's a policy question. It really depends on your institution. If you're working with bone marrow transplant, maybe you want to do you want to have a barrier, and you could not allow anyone to go through until they are 100% clean regarding their hands. But if it's rubbing out, going home, maybe it's yourself who want to make sure. And this is really the mentality. So the data is up to you how you use it. It's personalized, it's timestamped, it really builds up on all the evidence that we have, and you can look at it in aggregated mode, so the management can be very happy. Instead of looking into hundreds of thousands of training data, or what can they do normally? Not much. Now it's a click of a button, so they see the trend lines. How this department goes against the other one, or whether they completed the overall requirements that we set for them, like have your measurements above 95% for 2 weeks every single time. So we can really put in some gamification, put up challenges, competitions, like name some champions, like follow them. They have been doing it the right way. And the good news, we are seeing it. So this is a tool that we are happy to give the enthusiasts, the infection prevention and control experts who are dedicated to this topic. And then, this is supporting them to do a better job.
I want to ask you a little bit about the impact of COVID on hand hygiene, and I feel it's maybe a little inconsiderate to talk about the silver linings in the COVID pandemic, but I know I appreciated going into public spaces and seeing hand hygiene dispensers, alcohol dispensers in more places. And of course, I'm a proponent of hand hygiene, and I'm interested in your thoughts on what you've seen, the impact of COVID as it relates to hand hygiene, particularly in public spaces.
What we have started and what this whole COVID situation started is the democratization of hand hygiene. So instead of it's being handled as a privilege of the medical domain, it's for everyone. It is really for everyone. So that billions of dollars of campaign or hundreds of billions of campaign as a marketing, we can consider it. But factually, it was really good to clear the minds and set the focus on most important things, like social distancing, vaccination, and hand hygiene. These are the three more important and most important components. And you can still argue like which is more important and what are the barriers, but we all understand with the hands, without the hands, you go nowhere. And actually, this is what we try now to move forward with. This is a message for everyone. You want to go back to your office space and be physically there again, make sure your hands are clean. You want to use public transportation, you probably still put on your mask and you want to have your hands clean. Before you start eating, think twice, like, okay, well, I paid with money, I paid with my card, I touched the PIN pad. Like, who else did touch that? So all these things are becoming now not paranoid, but part of the regular way of protecting ourselves, our beloved, and making sure that we can train people at the level of hundreds or thousands or even more through our technology and through our training programs.
And that really brings us back to where we started, potential standards, best practices for hand hygiene and monitoring. I know you've done a lot of work with WHO and ISO. What can you tell us about that and how that's progressing?
So lucky for us, all of us, WHO had its 2009, so now quite oldish guidelines on hand hygiene, which became really a global and thick document on the importance of it. So that's now being renewed, and we are able to channel in. Lucky enough, there is a committee in Geneva now looking into the updates, and we are feeding in our new evidence because there has been a lot of new evidence created. And I really endorse CDC for doing the same, that on their website, collecting new evidence and trying to keep us all up to date, because there's a lot we have learned. This is a global experiment, what has happened in the past 3 years. And really on the top of that, now we are just finishing an ISO standard, the world's first international standard for hand hygiene. So ISO stands for the International Standardization Organization, and they are responsible for great standards like the medical device standards, like a lot of the Wi-Fi, the connectivity, a lot of things in the industry and now in the healthcare are standardized for a good reason, because that allows us to speak the same language. Without it, we can't compare apples to apples. And this is really important in hand hygiene. So with that new standard, that hopefully getting an in favor vote in I think April, all the countries are going to vote on that. We set the minimum requirements for institutions regarding their hand hygiene training, education, monitoring, and feedback program. So altogether, that's similar to some other companies like Jayco, Leapfrog. They started their own audit requirements, but they are focusing on hand hygiene just in their respects. This standard not only gives you the requirements, also gives you a lot of useful, not advices, but methods. How can you achieve those? And in that aspect, I think it's going to be unique and hopefully very well received in the community.
Tamás, what should we expect in the future from HandInScan?
So we will continue, I can assure you, we will continue trying to serve the community. So besides the medical domain, we have started to explore new industries like the biopharma, in the food industry, where there's a lot to be done with hand hygiene. And we really hope to get there into nursing homes, into government spaces, into all public areas, and make sure that people, once they use our system, they never forget that, hey, this can get visual. Even if I don't see the germs, they can be on my hands. So remember and do your hand hygiene properly.
Any predictions for the future of infection prevention in society?
I think it's going to be a huge challenge that we are facing. So despite the fact that seemingly we are over COVID, we're just learning about like how quickly these pandemic situations can emerge. And really with the globalization, on one hand, we really want to avoid lockdowns and entire countries being closed for months or years. This becomes inevitable unless we are able to do a much better job in educating the people. Prevention, prevention, prevention. This is what we have to prepare for. And for that, we have to use all available digital technologies. We have to use all available internet and social media platforms and make sure that we reach to the people, we empower them, and we give them the right tools so that they can do a good job on this.
I think that's a fantastic final thought. And if you've enjoyed the content and infection prevention podcast that we do here at Clean Talk, be sure to register at cleantalk.tv to join our community and to get information about future live events, including panel discussions and live streaming from infection prevention trade shows. On behalf of my guest, Tamás Haidegger, the product is HandInScan. We thank you for joining us today on Clean Talk.
Thank you very much.
Thank you, Tamás. And until next time, this is Brad Whitchurch, your host, reminding you to keep it clean.